Next, I call upon Ms. Boris for the presentation on the title Itinerary of Snakebite Victims in Sub-Saharan Africa, a Review Analysis. Ms. Boris. Thank you so much, sir. Please share your screen. I can see your video now.
Okay. Okay, thank you, sir. I will share my screen. Right.
Yes, your voice is also audible. Please share your screen. Okay, I got the screen. Please click on slideshow. Okay, very good, sir. Please continue. Thank you so much.
Okay, thank you for giving me the floor. My name is Boris Poumonnier. I'm from Cameroon, and me and a research team here in Cameroon, we are working on the identification of the itinerary of snakebite victims in Sub-Saharan Africa, and it's a review analysis. So we will go through the slides. So as summary, we can say that snakebite is a global health issue, and it was classified in 2017 by WHO as in the list of neglected tropical diseases. So globally, about 2.7 million of information occur around the world, with about 81,000 to 138,000 deaths yearly, with 400,000 people who are living with disabilities after snakebite. So the global burden of snakebite in terms of both morbidity and mortality, occur in Sub-Saharan Africa, in East Asia, and in South America. And about the statistics in Sub-Saharan Africa, we can say that yearly we record about 315,000 information with 9,000 amputations, mainly limb amputations, and 7,000 deaths. So snakebite is a neglected tropical disease that mainly affects poor people who are living in rural area, and it's really important to understand, community beliefs and the perception of those population who are the main target of snakes. So the aim of the review analysis that we conducted was to analyze the therapeutic itinerary of snakebite victims in Sub-Saharan African countries, to identify the factors that contributed to the worsening of patient outcomes, whether they have to go to the traditional healers or not. Also, to understand the health-seeking behavior between the choice that snakebite victims usually made between traditional healers and healthcare workers. And also, an important aim of our review analysis was to assess published papers related to the evaluation of the 2019 WHO global strategy that is aimed to halve by 2030, the morbidity and mortality related to snakebite in Sub-Saharan African countries. So what is the problem and why our review analysis seems important? Because globally, African countries lag behind the requirement in the clinical management of snakebite in terms of manufacturers of antivenoms, in terms of availability of appropriate treatment, in terms of the cost of antivenom and accessibility of healthcare facility in general. So as of today, very few studies and strategies are implemented, in African countries to identify the death toll related to snakebite. And also, besides the fact that there is a scarcity of data related to this neglected tropical disease, the data that are also available are not most often accurate. So this is why we aim to review the literature that was published regarding the issue of the itinerary of snakebites in Africa. And also, we wanted to see where African countries in general are positioned regarding the global strategy of WHO. So according to the methodology, we conducted a review analysis using the Prisma approach, which is the preferred reporting items for systematic review. It's a process that consists of, reviewing different journals, different research tools to identify papers and published articles, that are related to the topic that we want to analyze. And the keywords that we use here specifically were snakebite, itinerary, health-seeking behavior, care-seeking behavior, and sub-Saharan African countries. After our analysis, we gathered about 51 articles that were published regarding snake bites, but the articles that try to assess the therapeutic itinerary of snake bite patients in sub-Saharan Africa specifically were only about 7. And still using this Prisma approach, the majority of snake bites, although going to healthcare settings, most of them usually seek traditional healers. And delays from the occurrence of the bite to the administration of an appropriate treatment. The appropriate treatment here is seen as the antivenom, which is specific to fight the process of envenomation within the health facility. So the delays between the bite to the administration of the appropriate treatment at the health facilities range between 2 hours to 21 days in sub-Saharan Africa. So it means that about most patients, most victims of snake bite seek healthcare basically after 3 weeks on average. So we also we identify the determinant of the delays. Why people, seek healthcare very late? Why people in sub-Saharan Africa are living with disabilities? Was it possible to avoid those impediments to the young population? So they identified the determinant here were lack of transportation. So many patients usually rely on healthcare, on traditional healers because they do not have a means to go to a health facilities. Health facilities are located in a very remote place where the majority of the population cannot access. So we also have the long distance, to reach hospital, and the failure to perceive danger. It seems a bit strange, but in sub-Saharan African countries, because most papers were published in Nigeria, in Cameroon, in Ghana, and also in Burkina Faso. So sometimes it happens there that patients do not see the bite of a snake as a danger. They feel like they can handle it, and it's not a very urgent issue. So another determinant here was also the ignorance of patients and about the consequences. People do not see that when you are being bitten by a snake, you can develop, an hemorrhagic syndrome, a cytotoxic syndrome, or a neurotoxic syndrome that could lead to death. People do not perceive that because they are not aware of the consequences of the bite of a snake. So we also have a lack of community knowledge because it's not really reported that some community interventions were initiated to inform population about which step to take, after the people in the community is being bitten by a snake. So we also have the issue of trust in traditional remedies. In African countries, maybe like other countries in the world, people mostly rely on traditional medicine that is being initiated by their parents, by a person which is responsible and in charge of the family. So they do not see hospital or healthcare setting as the primary setting to take care and to handle the management of snake bites. So we also have the poverty and the cost of transportation. People are poor, and when we assess those people, we realize that many people do not seek medical care at the first time because they did not have enough money. They thought that if they need to go to the hospital, then the cost of treatment will be higher. And sometimes this could lead to impoverishment of the family as a whole. So I will also have the distance from the health facilities and the indirect cost of healthcare. This means that people do not go to health facilities because they know that if they go to health facility, the cost of antivenom is really expensive. And just by treating one member of the family, they will allow other members of the family not to have access to food, not to have access to education, not to have access to the basic and the primary needs that a family needs. So this is another determinant of the delay of seeking medical care. And we also have another important determinant, which is the low cost of treatment and the closeness of traditional healers. So usually the treatment of snake bite, when people go to traditional healers places, is much more lower than the cost that a healthcare facility need to provide care. And also traditional healers seems, in the papers that we review, they seem to be very close to the community. So people usually at the first time, they want to meet a traditional healer because it's somebody with whom they used to interact on a daily basis. So among the 51 articles, as we said, the conclusion is that the majority of victims usually meet traditional healers before seeking medical care from health facilities. So according to the assessment, because another objective that our study wanted to address was to assess where African countries are with the implementation of the 2019 WHO strategy to halve by 50% the burden in terms of morbidity and mortality from snakebite. And among the papers that we reviewed in Sub-Saharan African countries, none of them, was focused on identifying or evaluating that strategy. And we just want to recall the fact that according to the WHO strategy, the period between 2019 and 2020 was the pilot phase where countries were supposed to conduct, advocacy meetings to inform and to aware stakeholders in different countries about the issue of snakebite as a negative tropical disease. And from 2021 then to 2023, where we are, is the scale-up phase, where specific intervention, such as the improvement of antivenoms, the improvement of health policy regarding snake bites and snakebite envenoming, and the community intervention and the manufacturers of antivenoms should be scaled up to improve the accessibility nationwide. So none of those studies that we review have assessed that strategy, which is, let's say, a key point in the fight of snake bites globally. So these are the references that we use with the papers that we reviewed. And in conclusion, we can say that the review analysis regarding the itinerary of snakebite and assessment of the WHO global strategy for fighting the NTDs that we conducted also reported that the therapeutic itinerary of snakebite victims and the factors that we identify contribute to the witness behavior in Sub-Saharan African countries. And it was also reported that a very important proportion of victims, although they go to hospital, but they go to hospital settings with a huge delays that should be also addressed. So in conclusion, we think that regular educational and sensitization and preventive activities could help to reduce the witness burden of snakebite and snakebite envenoming. More research needs to be conducted in Sub-Saharan Africa related to the subject. And we also need to implement appropriate community interventions to achieve the expected result. So basically the recommendation are to have more research, to have accurate data, because we have scarcity of published articles, and it's very difficult to assess the true burden, the real burden of snakebite in sub-Saharan African countries. So this is basically what we have to say regarding the review analysis that we conducted. Thank you.
Thank you, Mr. Boris, for your wonderful presentation. Hi attendees, we have enabled a polling session for Mr. Boris for his presentation. If you have any queries on his presentation, kindly post your queries in QA option, where Mr. Boris can answer for that. Yeah, Mr. Boris, we have one question for your presentation. We are aware that in the northern part of Cameroon, this problem is very severe because of highly poisonous snakes. In our review analysis was lack of anti-venom in health facilities at the peripheral levels identified as a determinant for mortalities related to snake bites. Is there a policy in place for the Ministry of Health to subsided anti-venom in the country?
Okay, thank you for the question. Yes, what Itineray said is true. In the northern part of Cameroon, the issue of snake bite is very, very enormous. It's an enormous problem, and it's a fact because of the the geographical setting of the northern part of Cameroon. So regarding the policies that we have in Cameroon, we can say that officially we do not have policies regarding the management of snake bites. We have some recommendation of the Ministry of Public Health, that is in charge of providing antivenoms to the global population of Cameroon. But the thing is that the cost of antivenoms is usually high, and each hospital in Cameroon has to purchase the antivenoms, to a local market, and they feel like the cost of each antivenom vial could be around 100 USD. So it's very high, and most hospitals usually do not have means to purchase it. And when it's available, the cost is expensive, and most patients, cannot afford to pay the treatment when they are being bitten by snake. So we do not have officially a policy regarding snake bites in Cameroon. Officially, we do not have. We have some small recommendations, and we do not have also a national program for fight against snake bites in Cameroon. We have a program for chronic diseases and other diseases in general, but not related to snake bites.
Thank you, Mr. Boris. And you have another question here. Please, what type of review is this? Is it a literature, scoping, or systematic review? Asking because it didn't follow the steps of a systematic review, including registration of a protocol.
Okay, I will answer this question. We conducted a review analysis with already published papers and published articles on the topic that we wanted to address. So for doing so, we do not need an ethical review approval from an ethical committee or an ethical board. We just need, to follow the template of how to conduct a review analysis. And in the methodology that we use, I specify the fact that we use the PRISMA approach, which is the preferred, items used for systematic review. And I think that I can share the PRISMA approach for review analysis with you. Yes, we do not need an ethical approval or a specific protocol, but we design the protocol and then we follow the step that PRISMA recommended for review analysis.
Thank you, Mr. Boris. You have another question. Given the fact that delay between snake bite and arrival at health facility is a major challenge in our context, what measures to reduce complications during this period of delay?
Okay, thank you for the question. The delay between snake bite and the arrival at health facility, as we just showed in our current presentation, is huge. It can sometimes go to a month, you know. So what intervention could be put into place to tackle that issue? We need to have, you know, a specific community interventions by training the communities, by training the traditional healers on the early identification of snakebite and snakebite envenoming. Because we believe that if the population, if the communities are aware on the fact that snakebite could lead to death, I think that they will be more likely to uptake medical services at health facilities. And we also need, you know, advocacy at a very high level of the country. I'm talking of the Minister of Public Health. I'm talking about the government and different stakeholders like WHO, like other NGOs involved in the health sector in Cameroon. We need advocacy at a high level to help the country, you know, purchase antivenoms and to make it available and at a very low cost to the community. Because when people need to receive antivenom, only one vial of antivenom can cost the monthly salary of a worker in Cameroon. So you see that it's an issue that should be addressed at the community level, but also at a higher level involving stakeholders and different NGOs. Thank you.
Okay, Mr. Boris, you have another question. Please clarify all the methods and inclusion criteria of the countries into the study.
Sorry, I didn't get the question.
Please clarify on the methods and inclusion criteria of the countries into the study.
Okay, using the Prisma approach, we search the different, you know, the different within different journals and different researches tools like Medlines, like EBSCO, like PubMed, like you know, I mean, just other search lines. We type the name of our topic. We use the keyword snakebite, itinerary of victims of snakebite. We use terms like health-seeking behavior of snakebite victims. And all those keywords were integrated in the searching tools. And then we downloaded the articles and the published papers. So now we had, at the beginning, we had about 100 papers published on the topic, but we had to scope down to see which papers was published in Sub-Saharan Africa, because many articles were published in Europe, in Asia, in Brazil, in East Asia, but very few articles were published in Sub-Saharan Africa regarding our topic. So this is how we scope down using the Prisma approach. We just follow the guidelines of the Prisma approach that was published in 2020.
Thank you so much, Mr. Boris. You have another question. What can say regarding the manufacturing of anti-snake venom in Africa?
Could you repeat again, please?
What can say regarding the manufacturing of anti-snake venom in Africa?
Okay, during our review analysis, we realized that the issues of manufacturers of antivenoms is really important and deep, because I think the only manufacturers that we have that produce antivenoms are somehow located in South Africa and maybe in 2 other countries, but in Sub-Saharan Africa, there are no official manufacturers of antivenoms. And you know, this is a key issue that the WHO strategy published in 2029 wanted to address. We need to have local manufacturers, not in every Sub-Saharan African countries, but let's say in Central Africa, we can have a manufacturers of antivenom, like a pool of enterprises that should produce it. This is another issue, because Africa, especially Sub-Saharan African countries, need to import antivenoms, you know, elsewhere, and the cost of purchase is high, and also the transportation cost is also high, and it comes and it's been added to the issue of antivenoms. So I see another question regarding the involvement of traditional healers. I mean, you know, this is a very key point, I think that in Africa, we don't need to take traditional healers away of the management of snake bites, because they are the first people that snake bite victim encounters on their pathways. So we need to train traditional healers. We need to provide them with clinical knowledge and skills so that they can recognize that, okay, now I'm dealing with an envenomation snake bite, or I'm dealing with a non-envenomated snake bite. And normally, we need to motivate traditional healers to early refer snake bite victim to hospital or to health facilities. I think that what you are saying is true. We need to get them involved.
Thank you, Mr. Boris. You can share your email ID in the chat box so that the participants, if you have any, if they have any queries or something, they can ask you personally. And you have one more question in the chat box. Was any success record with the traditional healers whom people go to, and are their herbal remedies documented given the huge new of snake bite history in SSA?
Could you repeat again, please? Sorry, my network is disturbing.
Was any success recorded with the traditional healers whom people go to, and their herbal remedies documented given the huge snake bite history in SSA?
Yes. In sub-Saharan African countries, we have some cases, of envenomation that were treated by traditional healers, and finally, those patients, they recovered, without any disabilities. Yes, we also have that. So how to explain? I think that traditional healers, they also have their traditional treatment, maybe that work, but I think that we need to conduct more research to understand what kind of product, what kind of plant they are using. How could we integrate their treatment, in the official treatment or in the management of snake bites? Yes, we have some cases who recovered quite well without disabilities, and they were entirely treated by traditional healers without even going to healthcare facilities. We also have those cases.
Thank you so much, Mr. Boris, for your time and all. And it's a nice presentation. Please unshare your screen and be as a participant over there.